Hey everybody, this is Ryan Ferns, West Virginia Senate Majority Leader, giving my live update for the day. And I think I'm going to take a change from the usual rundown of the day to talk about an issue that we began debating in the Health Committee here in the Senate this week, and it's the Certificate of Need law that we have here in West Virginia. And what I'd like to do is give you a quick background on where the law came from, where it's at in the state of West Virginia today, and then what some of the research, all the research really, shows and says about certificate of need in our state here in West Virginia. The law began back in actually the 60s. It began in the state of New York, and then later in the 70s, the federal government adopted a program. And in order for states to get federal funding related to the program, they had to adopt their own laws. So back in the 70s, a number of states all across the country started adopting certificate of need in their individual states. The idea behind it at the time was it was state or government-run healthcare. In order, the government made the decisions whether or not there was a need for healthcare services in given areas in different states. And the idea was that it would control cost, it would keep costs down, and it would increase access to care. So that was the plan, that was the goal of it. After less than a decade, the federal government looked at the data related to the program and found that it wasn't successful. It wasn't serving its purpose, and in a lot of cases it actually had a reverse effect. As you can imagine, competition is good for driving down costs. So eliminating competition, which is what this law does, increase costs in a lot of cases. So this is something that I began working on 3 years ago. I've been interested in it the whole time I've been in the legislature. I knew it was a barrier to healthcare growth, access to services in our state. And 3 years ago, I started taking a serious look at it. Made one attempt at a bill that was unsuccessful, and then last year initially looked at streamlining certificate of need in our state, and was able to pass a bill that streamlined the process but kept certificate of need in place. The results that came back showed that healthcare providers across the state found a great improvement in their ability to grow and expand by streamlining the process. So I asked our legislative auditor to look at the impact of certificate of need in our state, and that kind of brings us to present day. And I've got the legislative auditor's report here in front of me, and I'll just read from here. It says the West Virginia Healthcare Authority's Certificate of Need program is an ineffective and unnecessary regulatory function. So that's the result of our legislative auditor. And so they suggested that we repeal the Certificate of Need. So looked at further data. I didn't want to just look at what our legislative auditor had done. I want to see what else was out there across the nation. Came across a extensive body of work done by the U.S. Department of Justice, their antitrust division. And the reason that the antitrust division of the U.S. Department of Justice is looking at this law is because they found that government interference in healthcare has led to certain healthcare facilities using this as a method to keep competition out, which is the whole purpose of the law, and create monopolies in certain areas. And so the U.S. Department of Justice has serious and grave concerns about this law. This particular report that I have was a presentation that the U.S. Department of Justice had done to the Georgia legislature. And in this report, they had cited 3 examples where they had to intervene in cases where antitrust issues had become a problem related to certificate of need. 2 of the 3 examples that was provided in this report to the Georgia legislature were about hospitals in West Virginia, ironically. So, big concern there from the Department of Justice. There's a report here from a research organization at George Mason University called the Mercatus Center. They've looked at certificate of need laws all across the country, compared and contrast states with and without certificate of need laws, and they find that, as you can imagine, in states that decrease competition related to healthcare, costs go up. That's the cost to all of us here that live here, and access to care actually goes down. And they find that in states that repeal their certificate of need law, they see a 30% increase in hospital beds. And so that means more healthcare providers, more access to care, and that goes for rural areas and non-rural areas, which I know is a big concern here in West Virginia. And I'm going to finish here with a extensive report that the American Medical Association has done, which cites numerous bodies of work related to this. And I'm just going to go through and read off a few of the points that the American Medical Association has found in their collective research. First here, they say that certificate of need laws have failed to achieve their intended goal of containing cost. And they have some quotes from some of the research they did. It says there is little evidence that CON results in reduction in cost, and some evidence to suggest the opposite. That's from a study by Christopher Conover at Duke University. The next quote here is, certificate of need has attracted many empirical studies. They find virtually no cost containment effects. However, they do show higher profits and restricted entry by for-profit hospitals, hospital systems, and contract management firms. That comes from a report in the American Healthcare Journal. And finally, not only have CON laws been generally unsuccessful at reducing healthcare costs, but they also impose additional costs of their own. So that's the cost side of it. I go through here further. They say CON laws, certificate of need laws, are anti-competitive and a barrier to entry. So it's decreasing investment in our state. CON laws are susceptible to abuse by creating opportunities for anti-competitive behavior. This is the American Medical Association also following up on what the Department of Justice said about the anti-competitive behavior related to this law. It says here, CON programs can impede patient choice. Obviously, the less healthcare providers you have, the less patient choice there is. So it's a hindrance to all of us living here in the state. And it says, last point I'll make here is there is little evidence that CON laws improve healthcare quality. And I know you can't see this. I'll post a link to it actually on my page. But with each one of these categories of statements that the American Medical Association has made, they cite 3 to 4 to 5 different research studies that have been done that back up that statement. So you're going to see, if you read the Wheeling newspaper, you're going to see a column that I write this weekend that summarizes all of those points as well. I'm going to post all of this research that I've done to my Facebook page so you all can read it for yourself. The evidence is pretty overwhelming. I think the Health Committee saw that this week, but you're going to be hearing a lot more about it in the coming days and weeks. So just wanted to give you a first bite at the apple. Appreciate you tuning in. I'm going to be here working over the weekend, so I'll probably post another update tomorrow, but I appreciate it. If you have any questions, don't hesitate to shoot me a message. Thanks a lot.